Hello and welcome everyone. Thank you for joining today's session on your favorite channel, Cancer Reach. Cancer Reach is an initiative by our very own doctor, Dr. Krishnamani, to help spread awareness about cancer and help patients and caregivers to access the right treatment at the right time. Today, we'll be discussing a very important but often less talked about aspect of cancer care, that is, second cancers and late effects of cancer treatment. With improvements in diagnosis and therapy, more patients are surviving cancer than ever before. But survivorship also brings unique challenges. Some patients may develop long term side effects from chemotherapy, radiation, surgery, or targeted therapies, while others face the risk of second primary cancers years after completing the treatment. So, today we're going to explore why these occur, how they can be detected, and what patients and families can do to manage and to reduce the risks. Joining us for today's topic is our very own doctor, Dr. Krishnamani, who has been a key figure at AY hospitals here in Hyderabad for over a decade, where he brings extensive expertise in managing solid tumors, hematological malignancies, and oncological emergencies. He has continually advanced his skills through prestigious international fellowships, strengthening both his clinical acumen and his global perspective. Throughout his career, he has held pivotal roles in leading cancer centers across India, earning a reputation as one of the nation's most trusted and respected oncologists. A strong advocate for continuous learning, he frequently engages in academic discussions and knowledge sharing platforms. Hello and welcome to you, sir.
Thank you. Welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. And before we start, let me wish everyone a very happy Teachers' Day, especially to all of you. Number one, you've been teaching, you've been spreading knowledge. To my teachers, to our teachers, all our teachers who made whatever we are today, we're very grateful to them. And today's topic is a very interesting one. It talks about the complications or the late complications of cancer treatment. So we'll go into that one by one as the session progresses.
So, firstly, can we start by understanding the terms second cancers and also understanding what is late effects? Both the terms. Can you please explain it to us?
Second cancer means uh, a different cancer which has come up. Okay, so now uh, somebody has a cancer today, and 5 years later, if they develop another cancer at a different site, that is called a second cancer. Okay. Now, late effects are late effect of treatment, which means those are bad effects or side effects of treatment which come many years after treatment. Could generally a year or more, usually seen after 3 to 5 years. Those are like that. Now, second cancers should be differentiated from metastatic disease. So, today somebody may have cancer, they would have got treated. 3, 4 years later, that cancer can recur and spread to the brain. For example, breast cancer. Imagine a lady was treated for breast cancer in 2020. You have treated her in 2020, 21, chemo, surgery, everything is over. Early stage breast cancer. Now in 25, after 4 years, this lady comes to you with severe headache. She says, I'm having blurring of vision. She says, I'm having seizures. Then you do an MRI of the brain. You find lesions in the brain. Then you do a scan. You find lesions in the lung, in the liver. You biopsy that. It says the old breast cancer has come back. That is metastasis. That is different. Second cancer means you had breast cancer earlier, or for example, you had an oral cancer earlier. You were operated in this area, in the lip area, or the buccal mucosa, we say, oral cavity. 3 years later or 2 years later, you develop an esophagus cancer or you develop a throat cancer. That is the second cancer. So one person developing two different cancers at different time points. Late effects are late side effects of treatment, generally chemotherapy.
How common is the risk of developing a second cancer among the cancer survivors?
The risk varies with age, smoking, with genetic risk, with type of chemotherapy and radiation. Now, if you look at, and it depends on the disease also. Now, for example, in a disease like lymphoma, the chance of getting a solid tumor again, like a breast, lung, is somewhere between 2 to 5%. The relative risk, we say. But the relative risk of a lymphoma, again, is between 10 to 40%. The relative risk of leukemia is up to 80%. So, the chances of, so what this says is the risk is higher for you to get blood cancers. That doesn't mean 80% of those patients will get blood cancer. That is not the point. It is in relative to the general population. So the risk is high in you because you are a cancer survivor, because you received chemotherapy, and your risk is higher for blood-related cancers like leukemia, lymphoma, rather than solid cancers like lung or breast or stomach, colon, etc.
Can you say that some patients are more prone to these late effects because of certain factors?
Age, smoking, tobacco chewing, prior radiation, past radiation, repeated radiation, re-radiation, we say, chemotherapy, especially drugs like alkylating agents, we call, or epipodophylotoxins. For example, etoposide, the name of the drug. Okay. Newer drugs like olaparib, which is used in breast cancer and BRCA positive, that can cause secondary AML in less than 1% or 1.5% people. So BRCA positive breast cancer, ovarian cancer patients who are put on olaparib, 1.5% can develop secondary. So your drugs, your chemotherapy, your radiation therapy, your age, history of smoking, tobacco chewing, all these are risk factors for development of secondary cancers.
So, do the patients get certain symptoms, maybe some warning signals that they can come to you, approach you for? Like, for example, if a patient is having breast cancer, the most common sign would be like unexplained weight loss with a lump. So, for secondary cancers, is there anything like any specific symptoms or any specific signs which the patient should look out for?
You should basically divide it into solid versus hematological. Solid tumor means suppose you're getting a breast cancer, secondary breast cancer, you'll come with a breast lump. You're coming with a lung cancer, you'll come with breathing difficulty, cough, blood in the sputum. If these cancers spread to other organs, you come with bone pains or headache or double vision, fits and all that. Secondary leukemias or lymphomas can present with swelling, lymph node enlargements, weight loss, fever, loss of appetite, and extreme weakness. Your hemoglobin will be low, recurrent fever, your WBC is low, recurrent bleeding, your platelets are low. So these are all the symptoms. I'll just give you an example. We had a lady whom we treated for breast cancer some 15 years back. Then 7, 8 years back, she developed ovarian cancer. You treated her for ovarian cancer also. So breast cancer, received chemo surgery and all that. Ovarian cancer, she received chemo surgery. Now she's been perfectly fine. Now she comes with complaints that I'm extremely weak. So she goes and gets checkup done. Her hemoglobin is terribly low, 4. Normal hemoglobin for women should be somewhere close to 12 to 14 or 12 to 16. So then you look up. She says, I've been fasting a bit. I've not been eating well. But that cannot explain. You do iron, you do B12 folate studies, all the blood workup, everything is normal. Her WBC platelets are borderline. They are not normal at least. Then you say, we start doubting. Suddenly, this lady has developed weakness out of the blue. She's a cancer survivor, 2 cancers. Twice she has been treated with different types of chemotherapy. It could be therapy related cancer. That is a late side effect of treatment, therapy related blood cancer. So we did a bone marrow. When you do a bone marrow, it shows acute myeloid leukemia. That is therapy related AML. So acute myeloid leukemia is a type of blood cancer. You have bad cells called blast cells, leukemic cells. They go and sit in your bone marrow. Your bone marrow doesn't produce good cells, it has only bad cells. So, this AML can occur de novo. In the sense, anybody can get an AML. Okay, there's no reason basically. Or it can occur also due to therapy, prior chemotherapy called therapy related AML. Now, these patients don't do well at all. They do very poorly compared to the other AML patients. So, you have therapy related AML because you had symptoms of weakness, fatigue, your WBC count, hemoglobin was extremely low. You did a bone marrow. Why? Because you had received cancer chemo in the past and therapy related AML. The treatment is chemotherapy plus allogenic transplant, we say. But unfortunately, because because it is therapy related AML, those patients don't do very well.
So, coming to the diagnosis part of it, what would be the diagnostic tests for these patients?
So if you're looking at any second cancer, you have to approach it in a second cancer way. What are you going to do? Like my teacher used to say, I am going to do a test to prove the disease. So how are you going to prove? By doing a biopsy. If a breast lump is there, a breast biopsy. Lung mass is there, lung biopsy. Next, I am going to do a test is to stage the disease, what stage it is. So you're going to do CT scan of the chest, abdomen, or a PET CT. Then I am going to do tests to verify the general condition of a patient, which is looking at your blood picture, kidney function, and liver function test. Additionally, in blood cancers, you do something called a bone marrow. You do something called a flow cytometry and cytogenetics in the blood to look at whether it's an acute myeloid leukemia or an acute lymphoid leukemia. And you also will probably do endoscopy and colonoscopy, especially for head and neck cancers, which are tobacco related.
So, sir, when you talk about diagnostics, we should we also concentrate on the screening aspect for cancer survivors over here?
Yes. So once you have treated a patient and you have declared that somebody is treatment free, you are going to call them on follow up. What is the general schedule? You call them once every 3 months for the first 2 years. After 2 years, you call them once every 6 months. After 5 years, it is once every year. And this follow up is number one to see if you are getting a relapse as a patient. Also, number two, to see late side effects of chemotherapy. And also, number three, to look for secondary malignancies, which is also known as metachronous cancer. Metachronous means two cancers which are spread many years apart. Synchronous cancer means today you go with a breast lump and you get evaluated for breast cancer. Doctor says, I also find a lump in your lung or in your stomach, and that is also a different cancer. So you have two cancers diagnosed at the same time. That is synchronous cancer. Metachronous cancer means one cancer diagnosed in 2020, another cancer diagnosed in 2025. So follow-up of a cancer patient is not only to see if that old cancer has relapsed, or or it is also to assess your general condition, also to see the late side effects of treatment, also to look for metachronous or second primary cancers.
Can you elaborate a little on the treatment aspect for these cancers, second cancers in patients?
Treatments are more or less same like your primary cancer, but understand. There are some challenges. Like suppose you have a breast cancer, you have removed the breast, you have radiated the breast. Now in the same area, if you develop cancer, you cannot give radiation again. You have certain limitations. Surgery also will be difficult because surgery has already been done before. Also, in breast cancer, we give a drug called adriamycin, anthracycline, we call that. If you had already used it in the past, you cannot use it again because if you use it, you will cause heart problems to the patient. So, when you are treating a second primary cancer patient, treatment is generally like you treat first time, but be mindful, has the patient received surgery, radiation, and prior chemotherapy, because your treatment will differ based on those.
So, what advice would you give for these cancer survivors? Like how should they plan the follow-up appointments, and also how do they improve their quality of life?
So follow-up appointments, I told you. First 2 years, once in 3 months, after 2 years, once in 6 months, after 5 years, you're technically cured, but come once a year. Now, during the follow-up, we take a history, we ask them how they are, what their problems are, any issues. We do a general thorough examination, yearly, maybe a mammogram, okay, a yearly CT test for other cancers like lung, etc. For the colon cancer, yearly CT abdomen with colonoscopy, and CEA is a blood test which is done. In ovarian cancer, we regularly do a CA 125 every 3 to 6 months. This is all. Now, what is the advice you will give? You will ask them to be mentally healthy, physically healthy, emotionally healthy, spiritually healthy. So you will ask them to eat well, take lots of greens, balanced diet, fruits and vegetables, fruit juices, good amount of protein, good exercise, yoga, walking, some sports, music. Okay, and be in a good mental space, emotions, emotionally also, and all this will definitely lead to their overall well-being.
So do vaccinations play any role in protecting the long-term survivors?
See, Uh, not really, right? So long-term survivors can develop some. If you remove the spleen of a patient, you can develop hemophilus and pneumococcal infections and all that. So they have to be on yearly flu vaccines. Uh, Hepatitis vaccination has to be given so that they don't develop liver cancers and all that. That's all.
So the last thing would be like with the evolution of immunotherapy or targeted therapy, which are continuously prescribed for cancer patients, are they going to be safer in the long run?
So long term, targeted therapy can cause now. See, so when we come to targeted therapy, trastuzumab can cause a heart problem. Pertuzumab can cause a heart problem. We call it can cause a fall in ejection fraction. We say that is the heart beating, but that is reversible. It is uncommon. We do a 2D echo every 4 months, and if it is due to the drug, if you stop the drug, the heart becomes normal. So not to worry. Long-term immunotherapy side effects, yes, you can sometimes have long-term hypothyroidism, long-term pan-hypopituitarism, we say. So you may need to be on thyroid medications for a very long time. Skin changes can be there, which can be dermatitis and troublesome for a very, very long time. Gut issues, colitis because of immunotherapy. Olaparib, I told you, can lead to secondary AML. A drug called etoposide and or alkylating agents can lead to secondary blood cancers after 5 to 10 years, which we call therapy-related AML again. Especially, there are two types of drugs: topoisomerase inhibitors and epipodophylotoxins. Both these drugs can cause cancers after 5 to 10 years, which are usually blood cancers. More importantly, you should stop smoking tobacco and alcohol because there is something called field cancerization. See, you are eating tobacco, you are smoking, that is getting applied all over your mouth, the inner part of your throat, going into your food pipe, into the tummy. Today, you may develop a lip cancer. Few years later, you may develop a inner cheek part cancer. You may develop a throat cancer because your whole upper aerodigestive tract is exposed to the tobacco. That is called field cancerization. So they are all second primary cancers. Now, what happens is, suppose you had a cheek cancer, you are given surgery, your this part is removed, this lymph nodes are removed, you are put a flap here, you get radiation and all that. Imagine after this is done, you develop a cancer in the throat. So giving radiation here will be very technically difficult. Or suppose you develop in the same area another cancer here. After surgery, after radiation, it is so difficult for the surgeon to remove that disease. And after that, you cannot give radiation here. So the chances of cure come down. And cosmesis is gone. Functional thing is horrible. There's no teeth, there is no munching, there is no saliva, there is no swallowing. So food intake, nutrition, everything takes a toll. So first, abstain from smoking, tobacco, alcohol. If you've been diagnosed with cancer, your risk of second cancers comes down significantly. Take your vaccines. More importantly, be on regular checkup and regular follow-up. If you have sharp tooth or dentures, take care of that. These are all the important things to be done.
So, can you summarize today's session?
So, second cancer are not so commonly spoken about. Um, what patients should understand is don't live in fear that, oh, I have finished one cancer, now will I'll get another cancer. No, that's not the way to look at life. But be aware. Don't be very careless also saying that, no, I have been treated with cancer, I will not get back. So be aware, be practical. Any unusual symptoms, even if you were treated years back, go back to your doctor, rule out cancer first. It could be anything. It could be a minor viral infection also. It could be an ulcer also, benign ulcer. But please go show your doctor because you were a cancer survivor or a cancer patient. Rule out cancer first. Abstain from tobacco, alcohol, dentures, and all. Just take care of that. Healthy food, balanced diet. These are all the important things. And lastly, to add, the late effects of chemotherapy. Many chemotherapy can cause extremely late effects, especially on the heart and the lung and the nerves. So, patients on chemotherapy can sometimes get progressive heart failure, we say. The lungs can get permanently damaged because of interstitial lung disease. A drug called bleomycin can cause that. They develop severe tingling and numbness in the palms and soles because of chemotherapy, especially if you're a diabetic. Drugs like vincristine and paclitaxel. So these patients, when they have these sensations, they have difficulty balancing, they have frequent falls, they're elderly, they hurt themselves. So there are a lot of things. So be aware, abstain from bad habits like tobacco and smoking and alcohol, healthy food and balanced diet. Watch out for second cancers, watch out for recurrence of cancer, watch out for late effects of chemotherapy. Any unusual symptoms, please go to your doctor to rule out these things. Don't live in fear.
So, can you enlighten us a little about the second opinion campaign which you are running?
So, as you know, we are running a second opinion campaigns for patients and their families who are very, very far in any remote corner of the country to send their reports so that we can give them a professional opinion free of cost. They can show wherever they want. It is just to guide them so that what little we have, especially today being Teachers' Day, I can tell you, we can share it with them and guide them the right way. So that because in many places, for example, the Northeast, seeking a cancer center, reaching a cancer center is hundreds of kilometers. Everybody has WhatsApp, everybody has 4G, 5G. You have certain reports, put it. What best we can from our end, we'll try to tell you this is the course of action. This is not a substitute for your treatment for sure. Go meet your doctor and then take it forward.
Thank you for enlightening us on today's topic, sir. And we hope to see you again next Friday with another interesting topic. Thank
Thank you
you.
so much. Thank you.